Hi, my name is Catherine Kirkland, and here are my notes. So first I'd like to discuss the definition of disease. Basically, disease is a state of dysfunction that is caused by a pathogen that gets into the body that is not supposed to be there, and basically it will just wreak havoc and start to cause problems and dysfunctions throughout different bodily systems. There are different classifications of disease. So basically it's broken up into two main groups. There are the congenital defects, and those would be things that were inherited or caused while somebody was in the womb, and they're present when the person is born. So some examples of this would be microcephaly caused by the Zika virus in a pregnant woman. This can cause microcephaly in the infant, or another example would be something inherited like Down syndrome or spina bifida. And the second category of these classifications would be acquired defects, and these are things that just become prevalent throughout the person's life. So the next thing would be the etiology, which is the cause of the disease. So examples would be, like I said before, the Zika virus. The Zika virus would be the etiology behind microcephaly in some cases. Another example of this would be if somebody had gene sequencing done to figure out exactly what gene was having a dysfunction that causes a genetic disorder. So next, pathogenesis. And pathogenesis is how the disease process evolves over time. So it would basically be how this person is going to experience the disease throughout their lifetime. The next thing would be signs and symptoms of disease. The symptoms are things that are felt by the patient, and the signs are things that are directly observable by a third party. So signs would be something like the person running a fever or coughing or diarrhea. This is something that somebody else can look at and see. Symptoms would be just feeling tired or just overall not feeling well. And then a syndrome would be a bunch of signs and symptoms together that are kind of correlated and just commonly seen together. So this would be a syndrome. Next would be the diagnosis, which is what everybody tries to get with a disease. You want to diagnose it so that you can come up with a treatment plan and figure out what the person's life is going to be like from here on out. So the diagnosis is what occurs after a physical exam, taking a personal history, or running some kind of diagnostic tests. So the diagnostic tests, you want them to come back within 95% of the normal range, so plus or minus 2 standard deviations. So you want it to come back within that. So if the tests come back with really, really low values that fall below the 95%, this is considered abnormal. Or if they come back a lot higher than the 95% range, then that's also considered abnormal. And that would indicate that there is some kind of problem. So then we have complications of disease. This is basically just something that the disease can cause. So say that you went to the hospital because you had COVID-19 and you ended up with pneumonia. So this would be a complication of COVID-19, not, that COVID is pneumonia. So then the prognosis is how you're going to be able to live out the rest of your life with this disease. Just basically, are you going to die? Are you going to live? Are you going to have a poor quality of life? Or are you going to have a good quality of life? This is something that can be determined once the disease is diagnosed, so that you know a little bit more about how things will work in the future. Thank you.